September is Sickle Cell Disease Month, bringing awareness to a painful blood disease that affects approximately 5,000 people in Illinois.
UI Health cares for more than 800 of those people as one of the largest sickle cell care centers in the country and a pioneer in care and treatment. Dr. Franklin Njoku and Dr. Paige Reilley join us with more. Thanks for being here.
Thank you for having us.
Yes, Dr. Njoku, let's start with you. If you could just talk to us about sickle cell disease.
So that's a very good place to start.
Yeah.
And so think of sickle cell disease, first of all, it's the most common genetic blood disorder in the United States and one of the most common globally. Think of the normal red blood cell as a donut without a hole in the center. So we like to describe it as a biconcave shaped cell. And that natural design is intentional to optimize oxygen transport and also flexibility of the cell, because the cells have to squeeze through narrow passageways in the bloodstream. So what happens in sickle cell disease is because of the genetic mutation, sometimes the cells sickle or become banana-shaped. And these banana-shaped cells are kind of sticky. They stick to each other and to the walls of the blood vessel, obstructing the flow of blood, causing intense, terrible pain, organ damage, and eventually reduced life expectancy. And whereas sickle cell can affect many racial groups, it's a predominantly African-American disease here in the United States. 90% of the patients are African-Americans. I would like to say that 1 in 365 black babies are born with sickle cell disease.
And Dr. Reilley, you lead the STAR clinic at UI Health. Can you tell us a little bit about the clinic and when someone would maybe get diagnosed?
Absolutely. So we try to diagnose sickle cell disease early, ideally, shortly after birth. And we do this with a program of universal newborn screening. So we try to identify every baby with sickle cell disease and get them into treatment by age of 2 months.
Wow.
Yeah.
That's early, yeah.
Very early. And the reason is because sickle cell, historically was kind of thought of as a childhood illness. There was very, very high mortality in early childhood. And we've all but eliminated this thanks to a robust kind of program of comprehensive sickle cell care that is really effective in the pediatric population, consisting of immunizations, preventative antibiotics, and things like that. But now we're faced with increasing challenges as these children with sickle cell disease get older. And now we're starting to see a big mortality spike in older adolescents and young adults. And that's what we try to address in the STAR Clinic program.
Yeah, tell us a little bit about that, how you guys bridge that gap in the STAR Clinic.
Yeah, absolutely. So it's great at UI Health because, we are really poised to give care across a lifespan for our patients with sickle cell disease. And the STAR Clinic, it's our sickle cell transition adolescent readiness program. Basically what we do is we just provide a lot of support to these young people as they transition to adult care. Being a young person and having a chronic illness, especially a chronic illness that's as challenging as sickle cell disease, brings in with it a lot of complexities. And another unique aspect of our program is we utilize what we call peer patient advocates. So these are young people who are living with sickle cell disease, who are graduates of our STAR program, that again just provide that additional level of support to our patients as they learn to navigate their disease and navigate their healthcare system as adults.
That's so innovative, all of that lifestyle support, which is really crucial. And Dr. Njoku, can you tell us, is there a cure for this disease?
Absolutely, yes. There is a cure for sickle cell disease. And I like to categorize the cures as, number one, the traditional stem cell transplant that has been available for a few decades now. And there's also the newer gene therapy that's only been around for about 2 years, and it's not widely available. At UI Health, our primary curative approach is through stem cell transplant. So what this means is we find a donor for the patient, and the donor provides stem cells that do not sickle. And then the recipient receives initial chemotherapy to wash out their bone marrow, and the donor cells are introduced to their bones. And when it takes root, it starts to produce blood that doesn't sickle. And the patient is essentially cured when it works, and they are rid of pain crises. They're also rid of organ damage, and it extends life expectancy. And this is in contrast to gene therapy, where the patient does not require a donor. So their own stem cells are re-engineered and reintroduced into their body after initial chemotherapy again. And I would like to emphasize that a cure is not the right approach for every patient. So some patients have mild to moderate diseases, and then we do very well with ongoing supportive care. So for patients with severe illnesses that need to be cured of their disease, they have to be carefully selected by a team of experts.
Yeah, that's incredible. It sounds like a range of treatment options outside of a cure as well that you're talking about there.
That's right.
All right, thank you so much to both of you. For more information, just scan the QR code on your screen or head to sicklecell.uihealth.care.